You know that sound? That relentless scritch, scritch, scritch of a dog just determined to, like, dig a hole in its own fur.
Oh, yeah. It's enough to drive anyone a bit nuts.
Totally. And if you're a dog owner, or maybe you're even studying to be a vet, figuring out why our furry friends get so unbelievably itchy, well, it can feel like trying to solve a real mystery.
It absolutely can. And that persistent itch, so often that's the main clue pointing straight towards allergies.
Allergies, right.
Think of it like this. Your dog's immune system, which is, normally there to protect them, sometimes it just gets a little overenthusiastic.
Yeah.
It sees something totally harmless, pollen, maybe certain food, as this major threat, and boom, it goes into full attack mode.
Okay, yeah. And that's kind of the mystery we're diving into today. Dog allergies, and that super common, super frustrating side effect, the itch. Our goal is to kind of break down what's happening under the skin, why it happens, and what we can actually do to help. Hopefully in a way that's clear, makes sense, maybe even gives you a few aha moments. We've looked at a lot of information to really bring you the key stuff. So where do we even start with this whole allergy puzzle?
Well, let's maybe start with the basics. What is an allergy, really, when we talk about dogs?
Okay, so like your dog's body has this great defense system, right? The immune system.
Right.
But when there's an allergy, this system gets a bit confused. It really overreacts to something that's actually not dangerous at all.
Exactly. We call that something an allergen. Could be anything, really ordinary stuff sometimes.
Yeah, like pollen or dust mites.
Pollen, dust mites, certain foods, even flea saliva. Think about people who get hay fever, right? Pollen isn't inherently bad, but their body treats it like an invader.
Okay.
So in dogs, this overreaction triggers the release of chemicals. Histamine is a big one everyone's heard of.
Right, histamine. That's the main culprit for the itch.
It's a major player, for sure. It, along with other things the immune system releases, causes inflammation and, yes, that dreaded itch.
And this isn't some rare thing, is it? Allergies in dogs.
Oh, not at all. They're really common. Any dog, any breed. Although, yeah, some breeds might be a bit more prone to certain types.
And it doesn't usually start when they're tiny puppies.
Typically not. You usually see it start after about 6 months old, often between, say, 1 and 3 years.
Okay. So the immune system mix-up is the root cause. But what owners usually see first, the thing that drives them crazy, is that itchy skin.
Exactly. Pruritus, that's the technical term. And it is by far the most common sign.
Pruritus, okay.
Yeah.
Sounds fancy, but it just means itchy. And it's not just a little scratch. It can get bad, right? Like a cycle.
A vicious cycle, absolutely. Starts with the itch, the dog scratches or licks or chews, and all that rubbing and biting damages the skin's natural barrier. That protective layer gets broken down.
Okay, and then what happens?
Well, here's the kicker. That broken barrier lets the normal bacteria and yeast that just, live on the skin all the time, they suddenly have an opportunity to multiply like crazy, and that leads to secondary infections. It's like leaving your front door unlocked.
Oh, wow. So the allergy starts it, but then these infections make it even worse.
Precisely. That's when you start seeing things like hair loss, maybe redness, scabs, little bumps. The skin might feel hot or even greasy.
And the dog just keeps scratching because now it's really itchy from the infection too.
Exactly. It becomes this loop. Itch, scratch, damage, infection, more itch, more scratching. Sometimes you even see open sores. It's miserable for them.
Ouch. So where do we usually see dogs itching the most when allergies are the problem? Are there common spots?
Yeah, there are definite hot spots. We often see them bothering their face and head, their ears, which, by the way, is why allergies often lead to chronic ear infections.
Oh, okay. Makes sense.
Also, their paws, you might see them licking between their toes a lot. Their belly, those little skin folds some breeds have, and right around the base of the tail, the hind end.
Okay, that's a good list. Paws, ears, belly, tail base. If your dog is constantly going after those areas, allergies should be high on your list of suspects.
Definitely something to think about.
So what can an owner do, maybe even before they get to the vet, to try and give their poor dog some relief?
Well, one absolutely critical thing, regardless, is top-notch flea and tick prevention, year-round. Seriously, even one flea bite can make an allergic dog explode with itchiness.
Just one.
Just one. Also, bathing with a gentle, maybe medicated shampoo recommended by your vet can soothe irritated skin. There are also topical things like mousses or sprays that can help between baths.
Okay.
But, if the itching is really bad or just won't stop, That's when you need the vet to step in. They might need oral meds, maybe even look into diet changes.
Right. So itchy skin is the #1 sign, the main event. But allergies can pop up in other ways too, can't they? What about hives?
They can. Hives, or urticaria, as vets call it, happen in dogs too. They look like those raised kind of red welts on the skin.
Like people get.
Pretty much. And what's interesting is they can appear really fast and sometimes disappear just as quickly, maybe minutes. Sometimes they're itchy, sometimes not so much.
Okay, but on a really furry dog, how would you even see them?
That's a great point. On dogs with thick coats, you might not see the welts themselves. Instead, you might just notice patches where the fur looks kind of puffed up or slightly raised.
Ah, okay. Because of the swelling underneath.
Exactly. Common spots are the face, legs, back, and sides.
And if you see that, what's the plan?
Well, if the dog seems otherwise okay breathing normally and all that, a bath might help wash off whatever triggered it, if it was something on the surface. But it's always a good idea to get it checked by a vet.
Right.
They might give an antihistamine or maybe a steroid to calm things down.
Right.
Some people ask about Benadryl. It might help temporarily, but you really need to get the right dose from your vet. Don't just guess.
Good advice.
Ah.
Okay, another scary one. Facial swelling. What causes that with allergies?
That's usually an inflammatory reaction again. You'll see swelling around the eyes, maybe the muzzle, the ears, the nose.
What triggers that usually?
Often things like insect bites or stings are a big one. Sometimes reactions to medications, or even if they just, stick their nose where it doesn't belong, like into certain plants.
So similar triggers to hives sometimes.
Yeah, there can be overlap. Treatment often involves things like cool compresses and, again, medication from the vet. But, and this is super important, facial swelling can sometimes affect their throat.
Oh, no.
And if that happens, if their throat starts to swell, it can lead to serious breathing problems really fast. So any facial swelling combined with any change in breathing, that's an emergency. Go straight to the vet.
Okay, message received. Breathing issues. Emergency vets.
Oh.
Got it. Now, allergies aren't just skin deep, right? Sometimes they hit the gut. Tummy troubles.
You got it. Things like vomiting, diarrhea, maybe they just don't want to eat. That can definitely be a sign of an allergic reaction, especially with food allergies.
Food allergies, okay.
And what's interesting with food allergies is they often develop over time. It's not usually like they eat something once and boom, they react. It builds up.
But there are common culprits, like specific foods.
Proteins are usually the main issue. Things like chicken, beef, dairy, sometimes eggs, corn, wheat, soy. It can be a range of things.
So how do you figure out if it is a food allergy?
That usually involves what's called a hypoallergenic diet trial. It's pretty involved. You feed your dog a special diet, either with a novel protein they've never had before, like venison or duck, maybe.
Okay.
Or a hydrolyzed protein diet where the proteins are broken down so tiny the immune system doesn't recognize them. And you feed only that diet, nothing else. No treats, no table scraps, no flavored meds, for usually 8 to 12 weeks.
Wow, that's strict.
It has to be. If the symptoms get better, then food allergy is likely. And it's worth noting, too, sudden, severe stomach upset can also be a sign of that really serious reaction, anaphylaxis.
Right, anaphylaxis, we definitely need to talk more about that. But quickly, respiratory stuff. Sneezing, coughing. Can allergies cause that in dogs, too?
Absolutely. They can get respiratory symptoms from inhaling allergens. Think pollen, dust, mold spores. Same stuff that bothers people.
So sneezing, coughing, maybe wheezing.
Yep, even seeming tired or having trouble catching their breath. It might start mild, but it can get worse. And it's especially a concern for those flat-faced, brachycephalic breeds.
Like pugs and bulldogs.
Exactly. They already have compromised airways, so any extra inflammation is bad news. Any sign of breathing difficulty needs a vet visit. Pronto.
Okay, so we've hit itchy skin, hives, swelling, tummy issues, respiratory signs. Now let's tackle the big one. Anaphylaxis. What exactly is happening there?
Anaphylaxis is the most severe, most life-threatening allergic reaction possible. Basically, the immune system unleashes this massive flood of chemicals all at once.
Okay.
And this causes the body to go into shock. It can affect multiple organs very, very quickly: heart, lungs, gut, skin, even the brain.
That sounds absolutely terrifying. What are the red flags? What should owners look for?
Key signs: pale gums, sudden extreme weakness or collapsing, maybe shaking or tremors, potentially loss of consciousness.
Oh my goodness.
In the worst case, cardiac arrest. You might also see a sudden drop in blood pressure, really rapid or difficult breathing, vomiting, maybe losing control of their bladder or bowels.
How fast does this happen?
Very fast, usually within minutes of exposure to the allergen. and it needs immediate emergency veterinary treatment. There's no waiting.
What kind of treatment?
It involves things like IV fluids to support blood pressure, definitely an injection of epinephrine, that's adrenaline, IV steroids. Sometimes, if their airway is swelling shut, they might even need a breathing tube and ventilator support.
Wow. Okay, that really underscores how serious allergies can be. Let's shift gears a bit and talk about the different types of allergies. Flea allergies are huge, right?
Huge. Flea allergy dermatitis, or FAD. It's actually the single most common skin disease we see in dogs, period.
And it's an allergy to the flea's saliva.
Exactly, to proteins in the saliva. And like we said before, it doesn't take an infestation. For an allergic dog, just one bite can trigger intense, nonstop itching.
One bite. That's crazy. What are the classic signs besides the awful itching?
You often see hair loss, classically right at the base of the tail, kind of a flea triangle sometimes. And because they scratch and bite so much, secondary skin infections are super common.
So what's the key to managing FAD?
Strict, relentless, year-round flea control. For the allergic dog, for all pets in the house, and sometimes you even need to treat the house and yard to get rid of eggs and larvae. No breaks.
Got it. Flea prevention is non-negotiable. Okay, what about environmental allergies?
Yeah.
We hear atopy sometimes.
Right, Atopic or canine atopic dermatitis. These are reactions to things in the environment they inhale or maybe absorb through their skin. Think pollens, dust mites, mold spores, even things like plant fibers or animal dander.
And these can be seasonal, like hay fever.
Some are, yeah. Pollen allergies often flare up certain times of the year, but others, like dust mite allergies, can cause problems all year round.
And the main sign is, let me guess, itching.
You guessed it. Itching is the hallmark, often in specific places again, paws, face, ears, front legs, belly.
Are some breeds more prone to this?
Yeah, definitely seems to be a genetic component. Breeds like Sharpies, Retrievers, Terriers, Bulldogs. Lots of breeds have a predisposition.
How do you diagnose Atopic?
It's often a diagnosis of exclusion. You look at the history, the breed, the pattern of itching, and you rule out other things like fleas or food allergies.
Yeah.
Allergy testing, skin tests, or blood tests can help pinpoint the specific triggers.
And that helps with treatment?
It mainly helps if you're considering immunotherapy, allergy shots, or drops. The tests tell you what to put in those shots or drops.
Immunotherapy. That's trying to desensitize them.
Exactly. You give tiny amounts of the allergens over time to hopefully get the immune system to calm down its reaction. It's a long-term strategy, though.
How long?
It can take months, sometimes up to a year, to see good results. And it's not a cure, more like management. It often involves a multi-pronged approach, trying to avoid allergens, meds for itch, bathing, flea control, and the immunotherapy.
Okay. And then there are food allergies, which we talked about a bit. Less common than environmental ones, you said.
Generally, yes. But still significant for the dogs affected. And remember, they can react to almost any protein or carb beef, chicken, corn, soy, milk are common ones.
And the itching might be year-round, not seasonal.
Correct. That can be a clue. If a dog is itchy all the time, no matter the season, food allergy is definitely something to investigate alongside year-round environmental triggers.
And the diagnosis is that strict elimination diet trial we discussed.
Yep. That 8-12-week trial on a novel or hydrolyzed protein diet, being absolutely strict about no other food sources, that's really the gold standard way to figure it out. If they improve, you then reintroduce old ingredients one by one to confirm which one causes the reaction.
Sounds like a process. Okay, last type. Contact allergies. These sound more straightforward.
They are, and thankfully they're the least common. This is a reaction from direct skin contact with something irritating.
Like what?
Could be certain plants, chemicals and cleaners, maybe a reaction to wool or synthetic fabrics and bedding, sometimes even ingredients in a flea collar.
And the itch is right where they touched it.
Usually, yes. Often on the feet or belly, areas with less fur that make contact easily. The good news is, if you can figure out what caused it and remove it, the problem usually clears up. Might need some topical creams from the vet to soothe the skin in the meantime.
Okay, so that covers the main players. Fleas, environment, food, and contact. It's definitely complex.
It can be.
Which really highlights why guessing isn't the way to go.
Yeah.
It's super important for you, the listener, to remember that figuring out exactly what's causing your dog's itch is really a job for your veterinarian.
Absolutely crucial. Allergy symptoms can mimic so many other skin conditions.
Right. So your vet needs to do the detective work, take a thorough history, do a full exam, maybe run some tests to rule out parasites like mites or infections first.
Exactly. And as we've said, elimination diets are key for food allergies, and allergy testing helps identify triggers for environmental allergies, especially if immunotherapy is on the table.
And the treatment plan will be unique to each dog, won't it?
Completely. It's definitely not one size fits all. It depends on the type of allergy, the severity, the dog's lifestyle.
So it could involve a mix of things.
Often does. Trying to avoid allergens if possible, hard with pollen, easier with a specific food. Medications are a big part, antihistamines, steroids, newer drugs like Apoquela or Cytopoint injections to target itch.
Topical stuff, too.
Yep, medicated shampoos, wipes, sprays can make a big difference in managing skin health and itch. And always, always good flea and tick prevention.
Plus, immunotherapy for environmental cases, strict diet for food allergies.
And treating any of those secondary bacterial or yeast infections that pop up, that's critical too.
So yeah, while trying to navigate the world of dog allergies and that just relentless itch can feel, well, overwhelming sometimes.
It really can.
Understanding the common types and the different signs is honestly the first and most important step in helping our furry buddies get some relief.
Well said. And maybe the most important reminder, everything we've discussed here today is for, educational purposes. It's information.
Right. It is not a substitute for actual veterinary advice.
Absolutely not. If you have any concerns at all that your dog might have allergies or any health issue, please consult with your veterinarian.
They're the only ones who can give you an accurate diagnosis and create a treatment plan that's right for your specific dog and their situation. Please talk to your vet.
Because ultimately, with the right diagnosis and the right management plan from your vet, we really can make a huge difference. We can improve their quality of life, quiet that itch, and bring some peace back to everyone in the house.
A much quieter, less itchy house. On that hopeful note, we'll wrap up this deep dive. Thanks so much for tuning in.
Thanks, everyone.